Hello and welcome to our presentation on Parkinson's disease. So first off, Parkinson's disease is a degenerative progressive disorder that affects nerve cells in deep parts of the brain called the basal ganglia and the substantia nigra. Nerve cells in the substantia nigra produce the neurotransmitters dopamine and are responsible for relaying messages that plan and control body movement. Parkinson's disease is a brain disorder common among elders that is mostly characterized by shaking, stiffness, and having difficulty walking, balance, and coordination in everyday life. So the main neurotransmitter that people with Parkinson's um, lack is called dopamine. So right now I'm going to play a video that can help you understand Parkinson's a little bit better.
Patients with Parkinson's experience a loss of cells to a region of the brain called substantia nigra. The substantia nigra produces dopamine, a chemical messenger responsible for transmitting signals within the brain that allow for coordination of movement. When dopamine levels decrease, it causes abnormal brain activity, leaving patients less able to direct or control their movement. Patients with Parkinson's will see a decline in physical, psychological, and neurological functions. The disease manifests in the form of slowed movement, known as bradykinesia, resulting in muscle tremors, gait problems, rigidity or stiffness, postural instability, and cognitive impairment. Since the disease is both chronic and progressive, patients gradually lose their ability to perform even the simplest of tasks. Although there is no cure for Parkinson's, a number of treatments are available for the management of motor and non-motor symptoms to be used in combination with medications. Currently, the most popular surgical therapy available for treating Parkinson's disease is deep brain stimulation. Deep brain stimulation, or DBS, delivers electrical pulses to brain cells to decrease the symptoms of Parkinson's. DBS typically works best to lessen motor symptoms like stiffness, slowness, and tremors. Targeted exercise that focuses on general mobility and dexterity may slow down the progression of the disease. Lifestyle modifications, a balanced diet, and rest may also slow down symptoms. An up-and-coming form of treatment for Parkinson's disease is virtual reality. VR is a fun way to practice motor skills, while also combating depression in patients. VR therapy ranges from treadmill training, balance and gait exercises, to therapy tools that provide excitement and prevent boredom. As technology progresses, the training options for improving motor functions will continue to expand.
Alright, so about the basal ganglia, it refers to a group of subcortical nuclei responsible primarily for motor control, as well as other roles such as motor learning, executive functions and behaviors, and emotions. For reasons not yet understood, the dopamine-producing nerve cells of the substantia nigra begin to die off in some individuals. When 80% of dopamine is lost, Parkinson's disease symptoms such as tremors, slowness of movement, stiffness, and balance problems starts to become more noticeable. So what is dopamine? So dopamine is obviously a neurotransmitter and exerts modulatory signals on cortex basal ganglia circuits to enable flexible motor control. Parkinson's disease is characterized by a loss of dopaminergic innervation in the basal ganglia, leading to complex motor and non-motor symptoms. So right here in this picture, you can see a healthy receptor cell transmitting dopamine normally, and this is the synapse of a person with Parkinson's disease with like really low amounts of dopamine, which limits the amount of movement they have or like motor control they have, which causes the shaking. So, I said earlier, symptoms of Parkinson's include tremor, rigidity, akinesia, and worsened posture and balance, which can also be known by this thing called trap. Oh my god, I broke kick. Alright, so here are some pictures depicting some more of the types of symptoms that a person with Parkinson's could have. The easiest way to remember is through this acronym right here, TRAP. T for tremor, which is usually shaking, usually starting on one side. R for rigidity, which means they have stiffness of limbs, neck, or trunk, or any part of their joints. A for akinesia, which is loss or impairment of their power of voluntary movement, so basically shaking uncontrollably. And P for posture and balance, which basically means that people with Parkinson's usually have pretty poor posture and balance. And here's another picture showing it more clearly than what I explained. And then next, moving on, it's gonna be Jesse talking about the types of treatments that can be used on people with Parkinson's.
Now we'll be talking about the treatments for Parkinson's disease. People with Parkinson's disease have low brain dopamine concentrations. However, dopamine can't be given directly into the brain as the dopamine molecule is too polar to cross the blood-brain barrier. Unfortunately, Parkinson's can't be cured, but there are medications and procedures out there that can reduce its symptoms. You may have significant improvement of your symptoms for Parkinson's disease, but over time these drugs frequently diminish or become less consistent. There are three main medications with Parkinson's disease, which include dopamine agonists, MAOB inhibitors, and levodopa. The first one we'll be talking about is dopamine agonists. These are the three main drugs for the dopamine agonists, and what it is the cause dopamine-like effects in the brain. The dopamine agonist is a broad category of medications that mimic the actions of dopamine in the body to relieve symptoms related to low levels of dopamine. The second medication we'll be talking about is MAOB inhibitors. MAOB inhibitors keep the brain from breaking down its natural dopamine quickly. The two most common drugs include these two that are posted on the left side. MAOB is an enzyme in our body that breaks down several chemicals in the brain, including dopamine. By giving a medication that blocks the effect of MAOB, which is an MAOB inhibitor, more dopamine is available to be used in the brain. This can greatly improve many motor symptoms of Parkinson's disease, and it can be very effective in the early to mild symptoms. On the right we see the last drug known as levodopa. Levodopa helps reduce or replace dopamine in the brain. Levodopa is used to manage Parkinson's symptoms such as tremors, stiffness, and slowness of movement. It is absorbed in the intestine and transported all the way to the brain, where it is then converted into dopamine. All Parkinson's disease patients eventually take carbidopa levodopa, or levodopa for short, which is known as the gold standard treatment for Parkinson's disease. Now we'll be talking about the surgery or procedures that could be done for Parkinson's. The first one is known as a lesion surgery. A lesion is a damaged or abnormal functioning area of the brain, and in this treatment, parts of the brain that are responsible for the tremors of Parkinson's disease are targeted. Surgery can be done while the patient is awake to determine exactly where to remove the lesions. The next one is known as DBS, or deep brain stimulation. In the brain stimulation, surgeons implant electrodes into a specific part of the brain. The electrodes are connected to a generator implanted in your chest near your collarbone that sends electrical pulses to your brain and may reduce Parkinson's disease symptoms. Although DBS may provide sustained benefit for Parkinson's symptoms, it does not keep Parkinson's disease from progressing. And here we see in the picture just exactly what a DBS, deep brain stimulation, would look like. And in this slide is a more in-depth video of just what deep brain stimulation is.
I was scared. And it was a quite emotional time. You don't know what your future is going to be like because, you see yourself losing your physical capabilities.
Mike has tremor-predominant Parkinson's disease, and his tremors were significant. He had said, I can't button my shirt, I haven't buttoned my shirt in years. All these normal everyday things that we are used to doing, Mike couldn't do because of his tremors.
DBS stands for deep brain stimulation, and basically, in a nutshell, what it is, it's a pacemaker for the brain, just like a pacemaker for the heart. So patients with Parkinson's disease may consider deep brain stimulation if they have symptoms that are not well treated with the medications, if the tremors that they have are not well controlled with medications, or if they're having a lot of stiffness and slowness of movement. Then DBS is a really good choice to consider.
As time went on, I saw how I was deteriorating. I said, to keep working, I've got to be able to do something, to stop this degradation of my system. And had that done in August. And then come October of 2017, he turned it on. It was quite an experience.
When I first turned it on, we started to first get tremor control. That's the easiest thing to see. It's like, oh, okay, his tremor's not there anymore.
Do you feel it going on?
Yeah. It's amazing. That's better.
I bet.
It was like chains from the arm just came off. I could move. I could button my shirt. I hadn't worn a shirt that had buttons on all the way down for like 5 years because I couldn't button the shirt,
He went over and looked in the mirror and buttoned his shirt up and down, and he just kept doing it over and over again, and he couldn't believe he could button his shirt.
Deep brain stimulation has really been a game changer in the treatment of Parkinson's patients, and so it's a therapy that we really believe in. Movement disorders we typically treat with DBS include Parkinson's disease, essential tremor, dystonia, and then also Tourette's.
Everything was just fabulous, after getting the DBS.
Good, same with the other. Yep, we gotta move it around to make it see exactly what's happening. Good.
It was a miracle.